Buon pomeriggio a tutti. Good afternoon, everyone, and welcome to the Italian chapter of Sigma International Alpha Alpha Beta. I am very happy to have the honor to introduce Prof. Richard Ricciardi, President of Sigma International and Professor of Nursing and Director of Strategic Partnerships at the University George Washington. I wish to thank Prof. Ricciardi for immediately accepting our invitation. And I am very happy to welcome you to our chapter in Italy. E benvenuti anche a tutti i colleghi italiani che in questo momento sono connessi con noi. Questo primo webinar 2021 abbiamo il grandissimo onore di avere con noi il presidente di Sigma Internazionale, il professor Richard Ricciardi. È il primo di una serie di webinar con cadenza mensile che ci condurrà da qui fino all'estate, con personalità importantissime di riferimento dell'infermieristica internazionale. Hanno già dato la propria conferma all'adesione la professoressa Linda Aiken, ben conosciuta, non è il caso che io la presenti, così come Anne-Marie Rafferty, e anche il professor Peter Griffith proprio pochi minuti fa ha dato la sua conferma alla partecipazione al nostro webinar. Questi nomi sono di grande importanza per la risonanza infermieristica a livello mondiale e noi siamo felicissimi di ospitarli dentro il nostro chapter. L'ultimo appuntamento che voglio ricordarvi e lanciare oggi, ma avremo modo poi di risentirci, è quello di settembre. A settembre noi speriamo di poter avere il nostro congresso Sigma, speriamo di poter avere le nostre induction finalmente in presenza e se non sarà così li organizzeremo comunque ancora una volta online. Grazie a tutti, buon ascolto, seguiteci, iscrivetevi a Sigma, sosteneteci.
Okay, I wanted to thank, first of all, Professor Richard Ricciardi for accepting our invitation to this first interview online, which is going to be the first of a series of monthly interviews that we are planning to hold throughout the year 2021 on the theme about the outcomes of nursing and nurses' well-being. So as we said, this will be the first of a series of online interviews. We have invited Linda Aiken, Anne-Marie Rafferty, and also Peter Griffiths. And they are all going to talk about a series of topics that are going to be, let's say, around the main topic of the outcomes of nursing and nurses' well-being. And then in September, we hope to hold in presence also our conference of our Sigma chapter, Alpha Alpha Beta, here in Genoa, if possible. If not possible in presence, at least we'll do this online. And we invite all our members to keep following us and to register and support our Alpha Alpha Beta chapter in Italy. Thank you very much.
Good afternoon and welcome and join me in welcoming Dr. Richard Ricciardi in this virtual interview. We would prefer to have him here in Genoa in presence, but we hope in the future we could have the chance to meet him in person. And we prepare 4 questions to speak with him about the role of Sigma for nursing during this pandemic event. So welcome, Professor Ricciardi. And if you agree, we'll start with the first question. And it's about human relations. And how important are human relations driving the nurses' workplace to address patients' needs. You have to unmute your mic. Okay. Okay.
Can you hear me now?
Yeah, perfectly.
Okay, thank you. Before I address the question, perhaps I can take just a minute or two for a brief introduction. First, I would like to very much thank you, your team, all of the chapter and members, leaders for this prestigious invitation to do this interview. I am really excited to be with you, and as Giuseppe said, it would have much better if I could have done this in person. However, I hope in the future that we will have that opportunity. I'm always willing to come back to Italia to be part of the culture there. Second, I would like to extend greetings from our Chief Executive Officer, Dr. Liz Madigan, the Board of Directors at Sigma, and of course, all of our members are greater than 135,000 members across the world to say hello, it's great to be with you, and to understand that we are all in this together, working towards improving nursing and healthcare for people in whatever nation or whatever community we are in. So it's great to be with you. I am really pleased to be with you, and I bring a warm welcome from across the pond in the US, but also from many other places. The last I will say before I address the question, I very much am honored and privileged to serve as the president of Sigma, and I thank you for that opportunity. And I look forward to continuing that for the rest of this year. I am available, and if there's anything that I can do as your president, please do not hesitate to reach out to me, and I will be happy to assist in any way that I can.
Thank you.
Oh, of course. Now, human relations, as nurses, we have learned very early that human relations is a most important aspect of our practice and our understanding. We are all very familiar with nursing and what makes nursing so very special. And it's that blending of science, the drive to understand the science and the practice, intermixed with humanity, and the need to understand the humanity and the value and the purpose of each individual person, each community, each colleague that we work with, each system that we are part of, in order to improve and understand. So human relationships are critical in facilitating improved care outcomes, as well as infusing much of what this meeting is about, building joy, strength, and resilience in our profession, and helping us to get through very challenging times like we just went through with the pandemic. So it's really about the importance of the blending of science and humanity, with the human relations part is overarching all of that. We know for sure that healthcare is a team sport. When you think about soccer, and the World Cup, who gets to the World Cup? They have a great defense, they have a great offense, and they have a great goalie. But that's not enough. It's not enough to win the World Cup. It's about each one of those parts of the soccer team understanding how they all work together and anticipating where that ball is going to go and how they're going to intercept or pass that ball. To me, it's the same in healthcare, as that we have to work with patients and other professionals that are part of our healthcare system to look at ways to build relationships, understanding each other, anticipating. And what that does, it really helps us because fundamentally this all gets down to trust. And human relationships help us to trust each other. And we know that when you look at the science of teams, and what's one of the most integral, most important part of being a team that has optimized function or has a high functioning team, one of the critical elements of that is trust. The only way to get to trust is about having human relationships. Healthcare, we know there are so many interdependencies in how we focus on care. The nurses have a very important contribution. Physicians have an important contributions. Sometimes there's overlaps in what we do, but then there's unique aspects of each discipline. Those interdependencies between all the healthcare professionals are part of the human relationship aspect of care. The patient needs an understanding of who's leading part of their care. At different parts of their care, maybe a physical therapist is leading their care. At different parts of their care, maybe the surgeon is leading their care. And at different parts of their care, maybe the nurse is leading their care. And that's all part of human relationships, understanding and working together and being able to communicate. We know, without question, that healthcare delivery is at risk for error. Safety is an important aspect of what we do in nursing. And when you look at the science of error and what is the most common reason that errors occur, it's because of lack of communication. And why does that lack of communication occur? Frequently, it's because we haven't developed a system or a way of communicating and having that relationship, that concept of human relationships. Is the patient providing us with the information we need? Does each member of the team understand what information on that patient is important? And are we communicating that? And frequently that is evolved around human relationships and the importance of human relations. And the last thing I'll say on human relationships, unless of course you have other questions, is that I know you all work so well together, but the human relationships help us to develop a system where the sum, the entirety of the system, is greater than each of its individual parts. So our goal in healthcare frequently is to take each person's strengths, what we do very well, and our talents, bring them to the healthcare delivery system and the market, and the way we deliver healthcare. And together, through human relationships, through communication, through trust, provide the kind of care that is effective, efficient, and safe, but also evidence-based.
Yeah, great. Thank you for your answer about this first ice-breaking question. And there is some terms that you used, some blinding science and humanity, trust, communication. So this is very important themes that we should remember. And we keep going with the second question. The pandemic has revealed the complex and unpredictable nature of the work environment. And we'd like to ask you, how can nurse leaders strengthen the nurse work environment and systems and transform them into healthy work environments?
Thank you for that question. That is a very, very important question, and one that we have really seen come to the forefront of healthcare delivery and systems, and also at the individual level with the pandemic. We know that healthcare systems are typically staffed to meet what's called the mean, or the average degree of healthcare work. What happens to that health system when it becomes overburdenized, or when it reaches a tipping point where the amount of work becomes all-consuming, and how do we adapt and adjust? And that's where we as people come in. We as humans, thinking, creative people, are put to the test, because there's only so much you can write in a book on what could happen. What happens on the ground, in the field, in a hospital, in a community, when there is an overabundance of work, but not a sufficient supply of workers? And that's a really, really important question, and one that leaders get paid to solve. That is the purpose of leadership. It's not to do everything the way it always is, or to be coming into work and saying, okay, everything's fine today. You don't need a leader for that. You need a leader who can anticipate problems that could happen, and to strategize, what are we going to do if? What if this happens? What are we going to do? What if this happens? What can we do? So leaders have to begin with themselves. And in preparation for your question, what can we do as nurse leaders? One, we have to remove ourselves from a sense of complacency. We have to put ourselves in a sense that as a leader, we have a big responsibility. Now, we're not in it alone. We have teams, we have others. But ultimately, it comes down to us to think about the situations where we are putting nurses in harm's way, people that work for us or are part of our team. And we need to be prepared to think about what strategies can we put in place. So first, leaders have to begin with themselves and self-reflect on themselves. Are they prepared to be a leader? Do they have the skills and the abilities to be a leader? Sigma provides many of those types of skills to help leaders develop. Sigma, we have a statement: nurses are leaders at any part of their career, wherever they're at. Whether they're just a new graduate, or whether they're a student, a new graduate, whether they're, been a nurse for 5 years, 20, 30, 50 years. Nurses are leaders wherever they're at. So leadership, I'm from the school, because I'm an example of this, that leaders are not born, they are made. Leaders are made through a desire to become a leader, a desire to learn more about the science of leadership, but then also a desire to execute that science so that you can get the skills through experience to be the kind of leader that you want to be. Leaders can also become better at what they do and help to build the work environment that you want by having a mentor, someone that can help them to think through how to be strategies. Leaders are getting paid to be strategic. Managers are operationalizing that strategy and help to deliver that strategy. So leaders, it's important for leaders to always think about new and creative ways to do the things that we do. Leaders need to build resiliency, build adaptability within teams and within individuals. They need to listen, reflect, and then act. Yeah. And in acting, it means that you need to be intentional, that these magical things won't happen by magic. In building an environment that you wish to have a solid workplace that is healthy and creative, you have to be intentional in creating and sustaining the work environments at all levels, whether it's in long-term care settings, whether it's in community settings, whether it's in acute care and hospital settings, or whether it's in academia. We all have to be intentional in thinking about how we can create an environment that's healthy. We have to be committed to appropriating resources to this. So when leaders are thinking about what's our strategy for next year, how are we going to create a healthy workplace, you have to think about what's in the budget for this. What do we have in our budget that's going to help us to facilitate creating healthy workplaces? and they need to be committed. There is a famous a saying, if you will, that I like to use a lot. And it's strategy without action is an hallucination. So you can dream a dream, but if you don't have a roadmap or a plan to drive that dream, it's an hallucination. It will not happen. So leaders need to be strong, dedicated, and committed by putting a plan together that actualizes their strategy to build a healthy work environment.
Great. Yeah. We need strategy and action, so put together, as you said. Very interesting. And also, when you said that we need to promote the desire to become a leader, because this is the big difference when we put in practice leadership skills in clinical settings. So, thank you.
Yeah, and Sigma, as you know, one of our main focuses, even despite the pandemic, where we repositioned ourselves to provide a lot of education, webinars, and contact around the pandemic and what are some of the challenges that nurses were facing during the pandemic and how can we help to facilitate and mitigate some of those challenges. But all throughout the history of Sigma, we have spent a lot of time helping nurses to develop their leadership talents, because it's just so critically important that nurses, as you know, the largest workforce in the world in delivering healthcare, need not only to be seen as leaders, but need to have the talents and skills and abilities to function as leaders.
Yeah.
So once we function and prove that we can lead, others will say, oh, we need this person, we need this nurse, we need to bring nursing in here because they bring a lot of ideas, a lot of strategies, and without them, we cannot be successful. Personally, I don't believe any strategy in healthcare can be successful without involving nurses.
Yeah.
I think it's impossible.
Yeah, I agree with you. Yeah. So, I can see you now. Probably your cam, it doesn't work.
Oh, my camera now?
I can see you.
I wonder why. Let me see.
Oh. Okay.
There we go.
Now you're back. Okay. So we keep going with another question for you. As you know, there is evidence in the literature that nurses often do not feel to be truly part of the healthcare organization they work for. It is as if there was a dichotomy between what nurses know what to do and what organizations want nurses to do. So in this perspective, what can Sigma do to help nursing directors transform organization and enable nurses to practice their profession to their full extent?
Yeah, I mean, this is so very important. This is the question, I don't know if you're familiar with the expression, but it makes the hair stand up on the back of my neck. It becomes very, very frustrating because nurses are frequently doing so much innovation and so much great things. However, we're not being recognized for that. And therefore, society puts forward this dichotomy of not really understanding what nurses know and what we do. What we have to do, and Sigma is part of this, but with the chapter development, but other professional organizations as well, is that it's been a challenge for nursing since the inception of nursing. We have to build an archetype or a brand where nurses are seen and heard as leaders. We really need to be seen by the public, by people who have influence in the countries that we work in. And the mechanism to do that, and is something that I feel very strongly and I work on in my professor role at GW, is how can we get more nurses engaged and involved with media? You know that an important contribution that Sigma has made, we were co-sponsors, of which I think you all are probably familiar with, was the Woodhull study. And in the Woodhull study, which looked at how frequently were nurses involved in the media to inform public and to engage in public discourse, nurses were identified as sources in the media only 2% of the time, in quotations, only 2%. And the largest workforce, nurses or nursing was mentioned in only 13% of the published articles, you know, in whether it's a local newspaper or a journal, you know, to inform the public. Nurses who were mentioned were often mentioned in stories about the nursing profession or labor markets, and were less likely to be mentioned in stories about research, policy, or the business aspects of healthcare, which is a big problem. So we need to do, as leaders, and this is on everybody across all of nursing, do a better job of trying to learn the skills on how to become more visible in the media through newspapers, TV, radio, all those, because many times the media experts, when they need an expert, they go to a physician.
Yes.
And it's a matter of habit, but it's also a matter of not understanding what we do. And so it's a two-way street. One, we have to educate journalists and, you know, people of influence, but we also need to develop the skills so that when we are in an opportunity to speak on TV or to be in a print journal or to write an op-ed or some policy piece, is that we do it, you know, with full force. So for me, one of the important parts of your question is how can we break that dichotomy of what nurses know and what organizations and systems believe, is that one, we have to develop an archetype that shows us as leaders. And two, we need to be more engaged with public discourse outside of healthcare. You know, more than just us talking between ourselves as nurses. That's only going to get you so far. We have to go outside of nursing. We have to reach out to journalists. And of course, we have social networking tools that can help us to do that. And we have to be in a position when someone asks us for professional expert advice that we say yes. Because the other thing that we found through the research is that often chief nursing officers, and I don't know what term you use for the nurse who's in charge of a hospital. We typically in the US use terms like chief nursing officer or vice president of nursing. When they are asked to provide information, many times in the US, and I don't know if this is true in Italy, but the data we have in the US says they don't provide nurses. They're afraid to provide nurses because the nurse might say the wrong thing. No, that's the wrong attitude. We need to have nurses that work in our system be voices for that system, to speak out, to say yes to journalists, to say yes to media whenever we are asked to do so.
Yeah. We need to be more visible, as you said. So also here in our country, in Italy. So thank you for your advice. And we are going to the next question. And how can nurses balance their private life with demands of their professional life? How can Sigma help nurses, no matter which setting they work, strike a healthy balance between their private and their professional lives?
You know, that's something that I thought a lot about before I became president of Sigma. And that's what led me to the call to action that is Infused Joy. If you want more information on the Infused Joy call to action, if you go on the Sigma website to what's called the Sigma repository, there's a search term. If you put in the search term Infused Joy, it will provide different materials and lectures around the concept of infusing joy. It is so very important. And I couldn't predict the pandemic was going to come. It was just very serendipitous, but it's something that I've seen over the course of my 40-year nursing career, is that the burden of care, the stress of care, what we are being asked to do, and this is not just for nursing, this is for medicine and other disciplines as well. What we're being asked to do is huge. You know, we're being asked to do more to save money because healthcare costs keep going up. You know, how can we reduce costs but provide care better? You know, and how can we do it for a population where the population is getting older? There's more people that have more comorbidities or more chronic care, chronic diseases. People are living longer with these chronic diseases, increasing an increased utilization of the healthcare system, whether it's at primary care, whether it's at acute care, whether it's long-term care. There's just so many demands being put on healthcare professionals and nurses. So I've seen that trend, particularly in the US and North America, you know, over my 40 years of practice in nursing. So I think it's critically important that we, one, recognize this as an important aspect of what leaders need to take on, whether they're leaders in academic settings or leaders in practice settings or leaders in administrative or research settings, have to really be conscious of the burden that healthcare places on healthcare professionals and nurses. And two, we all know that, I mean, because I'm practicing as a nurse practitioner, I'm still seeing patients during the pandemic. I know how much additional challenges the pandemic has already added to a health system that was already difficult to manage. So we have finding that for a long time after the pandemic, and it's still going on now, the pandemic is not over, that nurses are being, and I hate to just say nurses because I believe it's all the healthcare professionals, are being overburdened and over challenged. So it is critically important that leaders and leaders help by strategizing to develop ways to think about how they can institute policies that show and support the importance of self-care. That's one aspect. Is, you know, if you look at some of the great Fortune 500 companies, the international companies that are some of the largest companies in the world, and how are they treating their employees? And you see there's a trend that they're looking at ways to understand that a happy, healthy, well-balanced employee increases productivity. Yeah. We are a little bit behind that in healthcare. We're not keeping up with some of the big companies. So we need to follow that lead in finding ways that we can create an environment that is flexible and adaptable, that allows individuals to, one, take care of themselves, but two, also fostering an environment that allows for creativity, that allows for healthcare to think about new and innovative ways of delivering healthcare, a way of translating evidence into practice and then implementing that practice. Because once you've seen one community, you've only seen one community. Every community does things a little bit differently. Even within the same region of Italy, you know, different things happen within the same region. So you can't really standardize. And that's where the creativity comes in. The second thing that allows, and And I feel very strongly about this, and it's a big part of my message in Infuse Joy. It's really important for us in looking at how we can develop self-care and strike that balance is for us to find our purpose. What is our North Star? What is it that drives us to be that unique individual that we are? And how do we provide that unique contribution to healthcare? You know, there's so many great role models from Italy in the history of Italy that blend science and humanity, science and practice. And of course, I think for me, probably the greatest ever of all time is Leonardo da Vinci. If you look and read about Leonardo da Vinci, he was a brilliant scientist. He was a brilliant artist. He was a brilliant communicator. He had a brain probably like any other, but you know, we need to be more, because I think it's so important for us to strike balance, is for us to really strengthen our ability to get involved in the arts, the importance of art, the importance of creativity and being involved, whether you're a painter or a writer or a photographer, or you like nature, you like being out in the nature, you like to take walks through, you know, beautiful parts of Italy, you like to drink a nice glass of wine, you know, from Italy, you know, you like to be with your family and share a pasta meal with them. You know, it's all very important, but I think if we're only thinking about nursing and we're only thinking about, you know, science, we won't get to balance. We have to be more like Leonardo da Vinci, who was a great artist, a great drawer, a great scientist, a great mathematician, a great astrologer. Another, like Galileo, was also another good example in Italy, who understood, you know, science and astrology, but also had a very human side to him. You know, he was put in jail by the Catholic Church for this, you know. And so you have many role models in Italy through the history of Italy to help us to really understand balance. I also think that what makes these individuals great is that they had a purpose and they had something that really struck them, and a sense of gratitude for life and understanding that life is a gift and that we need to embrace and enjoy that gift. And if we do that every day, I think we can strike a balance. We can pull ourselves up and lift ourselves and our colleagues and, you know, our health system up from a very challenging time right now we're having in healthcare. It's possible, but we can't do it alone. We need each other. We need to also think about our other interprofessional colleagues. We shouldn't just be doing this for nurses. We should be doing it for our physician colleagues and our physical therapy colleagues. We need to be a team approach to striking balance, because I know you've heard the term weakest link. No matter how good one profession gets, if another profession is struggling, healthcare delivery will be challenged, because healthcare is a team sport. So we all need to be looking out for each other.
Thank you. So for the moment, we start looking for your resources in the repository of Sigma about to joyful and to the infusion joy, and so we are interested in reading those resources. So we arrive at the end of our meeting, virtual interview, and thank you for accepting our invitation, and we hope to see in person in the next future. And so thanks again, and see you.
Yes, it was my pleasure. Thank you very much for the invitation, and I wish you all well. Stay well, be safe, and I look forward to seeing you in person in Italia.
Great. Thank you. Bye.
Bye.
Much.
Bye.
Bye.
Thank you, Richard.
Bye.
Thank you much.
Ciao.
Ciao.
Ciao.